Welcome to a MCCEE tutoring services video providing you with all your USMLE and Medical Council of Canada exam content needs. Please check out my website for more tools to help you do well on your exams. This presentation will cover demographics. As you know, Q-banks are very helpful for studying for your standardized exams. They help with remembering the important concepts necessary to pass and excel on these tests. I'm not going to talk about that today. Instead, I'm going to talk about one of the most common mistakes I see when tutoring, the misuse of the demographic information at the beginning of the question stem. You should always be checking for age, gender, occupation and education, geographics, and race and ethnicity. Let's start with an example. A woman with a history of well-controlled hypertension comes into the clinic complaining of bumping into things. She says she feels clumsier than usual and has been having bad headaches when she wakes up in the morning for the past 2 months. She has bitemporal hemianopsia on visual field testing and papilledema by fundoscopy. What tumor does she likely have? Is it a meningioma, a craniopharyngioma, a pituitary adenoma, glioblastoma multiforme, or astrocytoma? If you need a second to think, pause the video right now. I apologize, this is actually a trick question. There's no way to answer this question without knowing the age. So let's break down the most common cause of bitemporal hemianopsia by age. If you're over 60 years old or elderly, the most likely cause is meningioma. And if you're an adult, pituitary adenoma. And in children, craniopharyngioma. So you can see just how important it is just from this simple example of looking at demographics. Let's take a look at gender. So obviously, reproductive organ diseases are in this, but what else? You also can have cluster headaches, which are much more common in men, or idiopathic intracranial hypertension, or tumor cerebri, is more common in women, as is variant angina. So what's the take-home message? Whenever you come to the end of a question and you've put your answer in, always ask, is this common for a man or a woman? That way you can tell if your answer is right, or at least give you a clue. Let's take a look at occupation and education. A 19-year-old college student has headaches and photophobia that progresses to seizures and unconsciousness. What should you be thinking of? Well, he's a college student, possibly living in a dorm situation. If that's the case, close quarters leads to possibly meningitis. Now, it's important to remember other components of the history, such as hypertension, flank masses, and a history of early renal failure, could indicate he has polycystic kidney disease, which could lead to a subarachnoid hemorrhage. But it's important to realize here that this is where you can easily just pick apart a small part of the demographics and it can lead you to your diagnosis. Let's take a look at another one. A 43-year-old sheet metal worker is in with complaints of headache, fatigue, stomach cramps, and back pain. This has progressed over many years. He says that he has pain in his wrists too, but he just attributes it to the job. CBC shows a hemoglobin of 112 grams per liter, or in US units, 11.2 grams per deciliter, WBC of 6,300, and platelets of 312,000. What is the cause of his signs and symptoms? Is it multiple myeloma, leukemia, occupational exposure, or an undiagnosed alcoholism? Well, you could read from just the title slide that it's more than likely an occupational exposure, but obviously something like multiple myeloma is not common in somebody who's 43 years old. Leukemia is always a possibility, but the problem is there are other causes that are much more likely in this case, and if you take a look at his white blood cell count and even the CBC as a whole, it's all normal. An undiagnosed alcoholism, again, not likely when he could possibly have lead exposure. And I apologize, the CBC is not normal, he has anemia, and all of these can be caused by lead. So let's move on to geography. Geography is very important when it comes to endemic diseases. For those of you who have watched my tick-borne illnesses videos, you know that those illnesses are only in specific areas, just like tropical illnesses. Fungal infections such as coccidioidomycosis commonly occur more in the southwestern United States, like Arizona. And in northern climates, you have less vitamin D accumulation and oddities, such as MS being more common in northern climates. So as an example, you would not pick Babesia macroti as an answer if the person traveled to Mexico, as malaria is more likely in this case. Another example is don't pick a spider bite as a cause of an ulcer if the person did not travel to or live in an area with nastier spiders that cause such problems. Let's move on to race and ethnicity. We all know the classic question, or a variation of it. A previously healthy 30-year-old African American woman has fatigue, arthralgia, and a nodular rash over the trunk and upper extremities for 3 weeks. There are 12 3 to 8 millimeter pale indurated plaques over the chest, back, and upper extremities. The liver is palpable as well, 2 centimeters below the right costal margin with a percussion span of 14 centimeters. And the spleen tip is palpable 3 centimeters below the left costal margin. There is no pain or limitation of any of the joints. A chest radiograph shows bilateral lymphadenopathy. What is the diagnosis? You should recognize this as sarcoidosis. It's an African American woman, less than 50 years old, and pulmonary signs and symptoms. It's a very classic question. But let's move on to maybe something else. Still kind of a classic question, but a little bit different. A 32-year-old female grocery clerk of East Asian descent at 14 weeks gestation comes in for a prenatal visit. Pregnancy has been uneventful so far. She is G1P0 and on physical exam her uterus is palpable at the navel. On ultrasound today she is shown to have polyhydramnios with the infant having ascites and pleural effusions. The father's side of the family has a history of microcytic anemia. What is the likely cause? Is it Turner syndrome, paravirus infection, anti-Rh or rhesus antibodies, alpha thalassemia, or beta thalassemia? You know that Turner syndrome is a possibility. It does cause some of these symptoms, but you generally don't see this in the fetus. Paravirus does not really fit with her job, although it can cause polyhydramnios. Again, she's a grocery clerk. Generally, people with paravirus will have more of a history of working with children, such as daycare teachers and the like. Now, even though her rhesus factor status is not mentioned, anti-Rh antibodies are not really likely as there's no history of transfusion or bleeding during pregnancy. Beta thalassemia is not possible in this case just because of the fact that you do not see the side effects from beta thalassemia until after the baby is born and adult hemoglobin is being produced. And alpha thalassemia is the most common in those with East Asian descent, which is the answer in this case. The take-home message here is after locking in your answer, check the demographics. So that means the age, gender, occupation and education, geography, and race and ethnicity. And check to see which one makes sense before you finally decide to move on to the next question. And here's the challenge that I give to you. After answering a question, check to see if the demographics fit the answer. And I mean every question. You may be slow at first, but you'll pick up speed as you continue the challenge, and you will begin to get more answers correct. And that brings us to the end. This has been a MCCEE Tutoring Services production. For a link to the website, see the video description where you can learn more about what MCCEE Tutoring Services has to offer. Please like and hit that subscribe button. Thank you, and have a great day.